Good morning.
All
My name
right.
is Cami McElhenney, and I'm Director of Training and Education for the National Association for Civilian Oversight of Law Enforcement. On behalf of NACOLE, I want to thank all of you today for joining us, where we will be welcoming experts from around the country to discuss jail and prison reform during COVID-19 and beyond. NACOLE is working during this time to provide additional resources and content to help all of you to continue your work and meet the challenges that this unprecedented event brings. Please make sure to look for announcements in the coming weeks as we add additional webinars and roundtables to our schedule. Before I turn things over to our speakers, I want to go over some logistics for today's call. All of you have entered in listen-only mode. Each of you may then type your questions for our speakers in the question area that is found on the GoToWebinar control panel on your screen, for most of you in the right-hand corner. You can type your questions in at any time, and then we will get to them, as many of them as we can. Additionally, I want to note that today's webinar will be recorded and posted to the NACOLE website along with any supporting resources provided by today's speakers. With that, I'll now turn it over to our moderator, Mark Anthony Johnson. Mark Anthony is the founder of Frontline Wellness Network, a California statewide network of healthcare providers working to end the public health crisis of incarceration. Mark Anthony formerly served as the Director of Health and Wellness at Dignity Empower Now, a grassroots organization based in the Los Angeles area. Mark Anthony?
Hey, y'all. Thank you, Cameron, for introducing the panel, introducing us. Really happy to be here with some really dope, awesome panelists who are rocking and rolling on this issue and in this moment around COVID-19. So just want to say welcome to everyone who's joined us this morning. We're going to be diving in on this issue of what's it looking like right now to advocate for jail and prison reforms during this moment. What are some of the opportunities we have in this moment, not just to make short-term gains, but also move towards long-term vision? And what role does oversight play in that? And we have some really phenomenal panelists with us this morning. I'm very excited to be sharing space with these folks. So I'm going to introduce them real briefly, and then we'll set up the panel and we will jump in. And our goal is to, as well, make some time for questions and answers. So as we're in conversation, please feel free to use the chat box as was named. And we will try and address your questions in the end portion of the panel. So we have with us this morning Andrea Armstrong, who joined the Loyola University New Orleans College of Law faculty in 2010. Her research focuses on the constitutional dimensions of prisons and jails, specifically prison labor practices, the intersection of race and conditions of incarceration, and public oversight of detention facilities. She teaches in the related fields of constitutional law, criminal law, race and the law, and constitutional procedure. Andrea Armstrong also serves on the board of the Capital Appeals Project and is a founding board member of the Promise of Justice Initiative, a new nonprofit dedicated to abolishing the death penalty and advocating for prisoners' rights. Professor Armstrong is a graduate of Yale Law School, the Woodrow Wilson School of Public and International Affairs at Princeton University, where she completed her MPA in International Relations in New York University. Thank you, Andrea, for being with us this morning. We're really excited to hear from you. We also have with us Ronald Day, who's the Vice President of Programs at the Fortune Society. Ronald is passionate about reentry, promoting desistance, dismantling mass incarceration, and addressing the stigma of incarceration. He provides oversight for Fortune Education and Employment Services and for Individualized Correction Achievement Network. This is a New York City Department of Correction initiative that provides pre and post release services to people incarcerated in New York City jails. Ronald formerly served as the AVP of Fortune's David Rothenberg Center for Public Policy, which advocates to reduce reliance on incarceration, promote model programming for the incarcerated population, change laws and policies that create barriers for successful reintegration, and foster just and equitable criminal justice system. Ronald, happy to have you here as well. Thank you. We're excited to hear from you. And we have Doug Smith, who is the Senior Policy Analyst with the Texas Criminal Justice Coalition, working to end mass incarceration and expand opportunity for people upon release from jails and prisons. He is the founding member of the statewide leadership council, whose membership includes leaders from across the state who have been impacted by the criminal, legal, and crimmigration system. Doug is an assistant adjunct professor of social welfare policy at the University of Texas at Austin School of Social Work, and he trains advocates nationally on effective legislative strategy. He serves on the board of the Austin Sobering Center and graduated magna cum laude from St. Edward's University in 1994, earning his MSW from the University of Texas at Austin in 2000. Thank you for being with us, Douglas. And we have Patrice Cullors, who is here this morning. She is the one of the co-founders of the Black Lives Matters international network. She is also one of the founders of Dignity and Power Now, a organization that's been fighting in Los Angeles to challenge sheriff violence in LA, which led to campaigns for civilian oversight against the sheriff's department in Los Angeles, and also to stop jail construction in Los Angeles. She's also the founder of Justice LA and Reform LA Jails, which has been leading efforts to not only stop jail construction, but also leverage the ballot box as a way to improve and strengthen oversight towards those long-term goals. Thank you so much, Patrice, for being with us here today. We're really excited to have you. So we're going to jump into this conversation, and just want to take some time to set kind of the frame here around what we're talking about. We know that the crisis that we're in and that COVID-19 is presenting on this moment is continuing to evolve. It is a rapidly evolving, dangerous and lethal crisis for many of us. Many of us are touched by it already, and certainly folks who are incarcerated are at a particular intersection of vulnerabilities, not just because the ways in which jails and prisons are not designed to meet CDC guidelines, but also the ways in which we know there's historic failures and deficiencies in the ways in which these facilities respond to the health needs of folks inside. Obviously, we've seen the ways in which oversight has lifted those things up, but certainly organizers inside of these facilities and on the outside of these facilities have been fighting not only to improve those conditions, but to get people out. And we're seeing those demands being lifted up in this moment in a very, very clear way. Very early in the announcement of these states of emergencies across the country, we saw a national call from community organizers, advocates, currently and formerly incarcerated people and their families calling for people to be released. In particular, we saw formerly incarcerated people and organizers within organizations that are led by formerly incarcerated people send a national coalition letter to the House and the Senate calling for emergency funding to get more people released, for more transportation home, to provide living stipends and access to health insurance, but also for more medical supplies for people inside, increased testing and the like. And we've seen a multitude of efforts on the state and local level as well. And a response from various folks, various jurisdictions, various system actors, including over 30 district attorneys that issued a national letter calling for more people to be released. Early in April, we saw the California Judicial Council order judges to reduce bail amounts for misdemeanors and non-serious felonies to zero. And the New York City Board of Corrections wrote a formal letter to the leadership of New York City calling for reductions in the jail populations. And we saw an echo of that from the Chief Medical Officer of Correctional Health Services in New York, who said that despite having what he considered one of the best medical workforces in the world, it was unlikely that their efforts could stop the outbreak inside of jails. And we're seeing this demand for reforms, demand to move people out, demand to actually build infrastructure that many folks have been calling for decades, including housing and healthcare and the like. We're seeing those demands play out very differently as it pertains to jails and prisons. And our panelists are going to discuss what are some of the challenges of that. What are the ways in which we're gaining ground with regard to jails, and what are the challenges that we're seeing on the prison levels as well. And we also know that, as was mentioned, COVID-19 is not a crisis that is presenting a public health danger in itself. It is actually built on a system that has a history of failing to meet the needs and the human rights needs of our folks inside. And so oversight is playing a really key role. And we know that states of emergencies are providing this really unique opportunity for us to push for reforms, but also presents certain dangers as well. One of those things that we've seen is very early in March, we saw a announcement from the Massachusetts Department of Corrections declaring that they were going to suspend disciplinary actions amongst their staff running their facilities. And so we see, again, these moments create challenges, but also opportunities. And our panelists are going to help us explore what are the things that are being done right now, what are the ways in which oversight can move us closer to some of the long-term visions of the folks who are on this call and beyond are fighting for, and what is some of that long-term vision? How do we move towards it? And so we are going to get started, and we're going to work our way across the panel as it's laid out on my screen, which means we'll start with you, Andrea. Our first question for our panelists here is, what's some of the work that you're doing right now towards getting people released from jails and/or prisons? What are the challenges you're encountering, and how are you navigating those challenges?
So thank you again for having me, and to be a part of this panel in particular is particularly gratifying. And I think you're right to kind of start out with what are we doing and what are the challenges. And so my work is primarily research-based. And so some of that research to support advocacy has been around looking at who has the authority to let people out, right? So our normal go-tos would be, the trial judge on an individual release, right? But here where we're talking about releasing groups of people, are there other people who might have authority to do so, like the Department of Health, for example, right? So we've been finding first the authority and then doing the work of bringing in people who have expertise and who would have something to say on whether there should be releases, and if so, how do we do that? So one of the things that we've been working with is the Louisiana Department of Health, for example. They have unique powers during a pandemic. They are not often as engaged in prison and jail administration. They tend to leave that to the custodial authorities. And so activating the Department of Health, and that includes then our parish and/or county level officers, to be in the room, to have these conversations, to put their expertise forward in support of depopulation, which is essential, right? You can't do anything else unless you start with depopulation, even if you want to then focus on conditions. So my work has been, doing lots of research, working with other disciplines. For example, architects are incredibly important right now, right? So for example, in Louisiana, for prisons, they want to centralize everyone who tests positive in a facility at Angola, which had been closed in 2018 because the conditions were so horrid and abysmal, from malfunctioning doors to water leaks to black mold to lack of ventilation. It was where solitary confinement was at its worst. It's where the Angola 3 were housed. That building was closed. There were plans to think about how do we transform that space. There are now today 100 people in that facility who not only are not receiving the care that they need, but also putting the greater Angola population, which is primarily elderly and medically compromised. That's one of the reasons why they're placed at Angola to begin with, putting them at risk. And so, a lot of advocacy work that I've been engaged at this point is bringing these different perspectives together, because this is not just a custodial decision process. There are so many other things. Architects can tell you whether there's sufficient ventilation, right? They can tell you about whether the cells are spaces in which that we can help keep clean, that can prevent transmission. So working with organizations like VOTE, Voice of the Experience, with the Promise of Justice Initiative to support the organizing and advocacy that they do. And then really grappling with this distinction between jails and prisons. When you talked about challenges, I think in Louisiana, one of the challenges that we've seen is that there has certainly been a lot more resistance to depopulation in the prison context than in the jail context. The jail context here in New Orleans, the sheriff issued his own call asking trial court judges to release people, which is significant in New Orleans. We have the lowest population that we have had in the New Orleans jail now since 1972. Whereas on our prisons, it has been the exact opposite, where this idea that public safety somehow doesn't include public health, right? Where pressure has been placed to at least review medically vulnerable people who are due to be released anyway within 6 months, right? So easy categories has been met with a task force that weekly reviews 40 cases at a time, right? Not displaying the urgency. And so, you know, the work here in Louisiana has been amazing. We have an incredible coalition of people who are working together, but the challenges that we see are very different from jails to prisons. And so I think that's kind of an initial overview of what we've been doing. And I'd love to hear from the rest of my colleagues across the screen on some of their work, because I'm hoping to be inspired by some of their work as well. Thank you.
Thank you for that, Andrea. Ronald, same thing for you. What are you up to right now? How are you moving in this moment, and what challenges are you seeing?
Can you hear me? I want to make sure I was muted before. So good morning or good afternoon. I guess it depends on where you are in the country, since this is a national conversation. You know, I appreciate the invitation. So, you know, as Mark Anthony mentioned, I'm a vice president of programs at the Fortune Society, and for 52 years, we've provided services to people that have been directly impacted by the criminal justice system. So we do alternatives to incarceration to try to stem the tide of people going into the system, and then we provide services inside of the facilities and to people who are being discharged from facilities, be they state, federal, or local. So what we have done in response to this COVID-19 crisis is that we've worked closely with the state, so with the governor's office, and also with the state corrections, New York State Department of Corrections and Community Supervision. And in addition, we've worked with the New York City Department of Correction as well as with the mayor's office. So how that has unfolded is that so the state, we've advocated for the release of people as our fellow colleagues have done that on this panel. We want to see as many people get discharged as possible. We know that it was going to be a challenge for some of the folks who are in the state facilities, to the point that Andrea has already made. There's some resistance. What they, to a large extent, allowed to do is to say, if you are like 3 months or 6 months away from your release, then they'll let people go early who are in the facilities. And they also said people who have technical parole violations, that they will discharge those individuals, because, I mean, for the most part, we know that those charges are really minor. They were for like a curfew violations, not reporting to your parole officer. And we have far too many people in our facilities for the technical parole violations in the first place. So that was a real opportunity there. The city, what they decided to do is we've been strongly advocating, because we know that in the jails, there's limited capacity, as there is elsewhere, to reduce the spread of COVID-19. So they've been very receptive to reducing the population. So we were already on this particular wave anyway, because in New York City, as you probably already know, we were pushing to close Rikers. So that campaign, although we offer services in the facility, we were one of the one of the primary organizations that was doing that. So we have reduced probably just in the last month or so about 1,500 people. So that is a pretty extraordinary number. We went from close to 5,000 people to we're down to, as of today, 3,800. So, and last week we had the lowest admissions to the city jail probably since the place has been open. We had only 10 admissions into the facility. I mean, we're talking about a situation where normally hundreds of people go into the jail on a daily basis. So to only have 10 people was pretty extraordinary. And if we had our druthers, we would not have anybody going into the facility, because, you know, the thing that has been critically important is that crime has remained low as the jail populations has gone down. So that is the work that we have been doing. And I'll just say very quickly, a challenge is a mind shift for administrators who run these institutions, because it's not typical for them to say we're going to be releasing people to the extent that we're doing now. They're prepared for when we change laws and we increase the chances that people go inside, because that has been our experience over the last 40 to 50 years. It is a complete, like, oh my goodness, how do we do this now? We're talking about letting people go. Normally, you let one person go, you let two people go, but never a situation where you're releasing hundreds of people. So that is the challenge. They don't really have the mental infrastructure to kind of deal with how do we do this, and as well as the idea of how do you respond, for example, if someone who you release gets rearrested for a crime or something like that. So that is often how corrections folks and parole folks think about these issues. So that has been the challenge, to get them to do something that typically they are against.
Thank you, Ronald. I really appreciate some of the things that both you and Andrea are lifting up, right? Just this idea that challenging folks to see public safety as public health, right? But also, like, what is not just the physical infrastructure we need to get people released, but also the mental infrastructure. Just really appreciate that framing. Patrice, talk to us about the work that you're doing in LA around releases at this moment and COVID-19.
Sure. I mean, I think, you know, for this conversation, an important framework for the audience is that many of us on this panel, and I believe many people who are either tuning in or will listen to this later, have been doing this kind of work for quite some time. And when we have challenged the releases of our community members and our loved ones, we've often been met by a load of bureaucracy that is led often by the DA's office or the sheriff's department, or often our county board of supervisors. And so while COVID-19 is just a moment that has really pushed us, not really us as advocates, it's always been urgent for us, but it's pushed the rest of the county and I would say counties and cities across the country to recognize how inhumane the caging of human beings actually is. And when you have a pandemic at your feet, how are you going to respond to it? And I think in Los Angeles, because there is a strong local movement, from the very beginning, Justice LA went into high gear around responding to what was happening inside of the jails, obviously receiving multiple phone calls from our loved ones saying they were scared. They were scared that it was they were going to end up getting COVID-19 and it was going to spread across the jails, and that the already negligent sheriff's department wasn't going to be responsive to their needs. And so we created a set of demands to almost every single elected official in our county. If you go to jlacovid19.org, you can see the set of demands, and you can also see the set of actions we've taken since February 29th. On February 29th, we had about 17,000 daily prisoners inside the Los Angeles County jail system. As most folks know, Los Angeles County is the largest jailer in the world. To date, we have about 11,990 daily prisoners. So we have decreased the population by a little over 5,000. That's the lowest the population has been since the 1990s. And our goal, obviously, is to not stop there. In fact, part of Mark Anthony's work with Frontline Wellness Network brought together a group of healthcare providers who launched a video really challenging the idea that incarceration is safe for us right now. In fact, the video challenged the opposite. Not only is it unsafe for the people who are inside of the jails, it's unsafe for the healthcare workers who are forced into that environment. And so we've been working alongside Frontline Wellness Network to get out that message. We've been working closely with La Defensa, led by Eunice Hernandez, who has been challenging the judges. As Andrea said earlier, we have trial judges who can say, no, I do not want to see any of these cases any longer, or yes, these people can go home. Unfortunately, many of our judges have been stubborn. We have the Department of Health that didn't go all the way in which we needed them to get people out of jails. And so I think this has been a very eye-opening moment for us as advocates as well, to get to see every single infrastructure and their role in either jailing our communities or getting our communities home. And I think it's a test right now for elected officials and appointed officials around what matters most to them. Is it the rhetoric of, quote, public safety, or are we going to reimagine what public safety is in the moment of a pandemic? Public safety right now means that every single human being, including people who are incarcerated, are getting the care that they need, that they're returning back into their communities, that they are safe, and the people that are caring for them are also safe. But I think it's critical that we don't just talk about policy in this moment, but we talk about reimagining what our counties, our cities, our states can look like post the pandemic.
Thank you, Patrice, for that call for reimagination in this moment. Douglas, talk to us about the work that you're doing, some of the challenges that you're seeing and how you're navigating them.
Certainly, I want to just say how honored I am to be on this panel, and thank you, Patrice, for using that term. I'm going to join you in that space of reimagining, which I think is where we should be right now. I think a lot of the efforts going on, just sort of that the people on this panel have demonstrated, really kind of speak to how the level of coordinated activity happening in Texas is also happening elsewhere at a really high level. I've seen a level of coordination in Texas unlike anything that I've ever seen. And, you know, I think it speaks to the level of investment in organizers and advocacy organizations led by people who are impacted by the criminal legal system. And it also speaks to the need to continue those investments, particularly in areas outside of large cities, because where we're seeing the greatest reductions in county jail populations are also those same areas where organizers can wield actual power. So but because of that coordinated activity, a lot of us were able to come together and act very quickly. We created a blueprint for what we called mitigating disaster. We were able to identify, really sort of elevate the most important things that need to happen, touching on what Andrea already said, like you have to reduce your populations. That's number one. And those counties that have done it have seen far less spread within their county jail systems. I think I'm going to sort of elevate San Antonio or Bexar County for their efforts, because I think they've seen the greatest reduction in the county jail population, which is roughly 1,000 compared to all of the other cities in the state. And not only did their entire system, their county judge came together with their sheriff and their judiciary, and everyone worked together to reduce that population. Moreover, they were able to bring in the Health Science Center. They have a medical school there, and actually station people at intake. And so it really was a coordination of healthcare systems and the criminal legal system. So, and I'm speaking to a lot of other people's efforts. What I will say is some of the barriers. The governor has not been cooperative in this effort. In fact, the governor stood in the way of these reasonable efforts. And I could just name Governor Abbott because he bears responsibility for deaths inside of jails and prisons that could have been avoided. And we just say that on this call. He issued an executive order that actually superseded the authority of the judiciary to issue a personal bond. He actually allowed people to bail out who could afford it, but he took away the judiciary's right to issue a personal bond on personal cognizance. And if the individual had any history whatsoever of a conviction that involved violence, it could be a bar fight 20 years ago and the person's there on a misdemeanor, they cannot get out, and he suspended speedy trial. So he's holding people there. He suspended the sheriff's right to do good time credits for anyone in that category. So any efforts that have been made in a coordinated fashion on county jail effort, Governor Abbott screeched to a halt and started building back up the county jail population. Testing on the prison system. So despite all of our communications, what we have heard is that the directive from the governor is not to take COVID-19 into account in making release decisions. And so we've spoken to legislators. They have told us that they're powerless. We've spoken to the chair of the parole board, and they said, you need to talk to the governor. We spoke to the governor and they were rather dismissive. And so the result of that is that now there's a widespread outbreak inside of our prison system. There's about 50,000 people on lockdown and have been on for weeks. There are more than 1,000 or almost 1,000 confirmed cases, but that's medical testing, not surveillance testing. So probably the number of cases is in the thousands. As of yesterday, there's 12 confirmed deaths. And those numbers we anticipate to grow, and that's a direct result of inaction. Because had they acted earlier, they would have been able to spread out the population somewhat more effectively. So today, a number of organizations, including my own, are launching a campaign. We're calling it #SaferAtHome. We are doing a tweet storm, calling the governor, let him know that throughout the state, we are unified. The number one thing he should have done and can still do is to authorize the release of some of the 77,000 people who are eligible for parole in our system right now, irrespective of the nature of offense. If people have done their minimum sentence and have completed their whatever programming or what have you, let them go. Moreover, if you're people who are approved for parole and just waiting for programming, if it can be done in the community, then let them do it in the community. That's our demand, and we appreciate people amplifying those tweets. #SaferAtHome.
Thank you, Douglas, and thank you for that update on the action that's happening today. Really appreciate that. So I want to move to the next question, and we'll actually just work our way back in reverse order here. And so, we know that we're all working on multiple fronts. A lot of us as organizers and advocates are working multiple leverage points to try and move the goals that we have. And oversight is situated within that landscape, right? And so what are the ways in which you see oversight mechanisms playing a role in navigating these current conditions and moving us closer to those goals, and what are the ways in which you are using them? And we'll start with you, Douglas, if you could take 2 minutes to tell us what you're seeing and how you're operating on that.
Oh gosh, well, mine will be quick. In terms of using oversight mechanisms, Texas doesn't have independent oversight over its prison system or its county jail. We have regulators. We have 4 regulators that oversee the about 120 or so county jails spread out over 254 counties, and they enforce regulatory standards. But we do not have independent oversight either over any of them. We have independent oversight over our youth systems, but not over prison system. And the result of that, of course, is that all we know about what's happening inside of our prison system is either what our state prison system, Texas Department of Criminal Justice system is willing to share, so we at least get the transparency of the daily numbers, or what we hear from people incarcerated who oftentimes can be dismissed. And what we're hearing inside is that any of the efforts to mitigate the spread have been delayed, and even today, trustees working, they haven't done the type of sort of medical screening that would be appropriate until very recently. And in some cases, there have been lawsuits that have been shot down just asking for basic protective equipment. So we have not had the benefit of independent oversight in order to ensure that CDC recommended actions took place. And so I think a lot of that is going to come out over the weeks and months ahead, and it's going to speak to the need to finally institute an independent monitor over Texas prisons and county jails.
Thank you, Douglas. Patrice, I know the work that you've been leading in LA includes that landscape. Obviously, there's a lawsuit that you've helped move forward in Los Angeles. There's also work that you've led around Measure R, which is strengthening oversight. What role do you see oversight playing as you're moving these strategies?
Well, I think oversight is critical in this moment, and any and all oversight bodies should be playing a lead role in both asking for what people on the ground are asking for, which is the release of community members out of county and prisons and federal jails. And so I think that's important. Oversight bodies should not remain silent in this moment. They should be positioning themselves as the body that is the most interested in what's happening. They're often hearing from family members about conditions pre-COVID, especially in our jails, around how disgusting and filthy they are. And so that should be a prime concern for oversight bodies. They should be passing motions, calling for more investigation, more products for people to be able to effectively social distance and be safe, and also people coming home. One thing I will say, as Mark Anthony mentioned, we did file a lawsuit on Friday. We as in lead plaintiffs, our Youth Justice Coalition and Dignity Empower Now, and we worked with a host of lawyers, Aaron Littman from UCLA, Alicia Varani from UCLA, Dan Stormer, ACLU. I mean, we are, it was important for us to push the boundaries at this moment. It is a pandemic, and we felt like even though we had released 5,000 folks from our jails, there's still more people to be released. We think over half of the jail population in its current form can be released right now. And so we are pushing for that both through the lawsuit and in other ways.
Awesome. Thank you. Ronald, same question for you. What role do you see oversight mechanisms playing in the goals that you're pushing for right now?
I agree with Patrice that oversight is really critical. It has always been critical, but especially during this particular time. I think the question is the oversight agency a paper tiger? Because if the oversight agency has responsibility that is not actually exercising, or if the administrators are not listening to the oversight folks, then I mean, what do we have here? If there's a time when oversight should be implemented, and where there should be some real serious conversations between oversight and the administrators, is now. And what I do appreciate, and what we give credit where credit is due, and Mark Anthony, you've already mentioned this, is that the Board of Corrections in New York City did issue a letter and asked for the commissioner to reduce the jail population, and they've heeded that particular call. And I'm actually honored to say one of my colleagues, Stanley Richards, our executive vice president, is actually on the Board of Correction as a formerly incarcerated individual. So that is unique. So they've responded to that particular call. We've had the union, the officers union, dispute that, say no, you don't want to be releasing people at the levels that they've talked about. but the Board of Correction was kind of insistent that this is something that needs to happen. And the numbers have been going down. We talked about getting to about 3,300 people in Rikers in order for us to move to the different model, right? The facility-based jails. I mean, the different borough-based facilities, excuse me. And we're 3,800 people. So we thought that it was going to take us several years to get to that particular point, but COVID-19 has put us on an accelerated platform to get us there. So I mean, oversight is really essential, but it depends on what the oversight folks are actually doing and whether they're calling on the administrators to do what they know needs to be done.
Thank you. Same question for you, Andrea. What are you seeing in terms of the role of oversight?
So in Louisiana, we have zero statewide oversight. I mean, zero. And at the same time, I think that this presents a moment to talk about what statewide oversight would look like, right? So, so many of you know Michelle Deitch, who's a professor at the University of Texas, and some of her work has actually documented how several oversight bodies throughout the country originated in these moments of crisis, right? They followed the inability to respond to crisis. And so we have really taken that to heart here in Louisiana. One of the demands that was made by Voice of the Experienced by vote by the governor early on was for the creation of a medical task force that included family representatives currently incarcerated, public health officials, right, as well as the standard kind of group, and this idea that they would be responsible for meeting and overseeing compliance with medical guidelines in prisons and making recommendations on broad categorical releases. And so even though we don't have statewide oversight, we are trying to use this as a moment to argue for real and tangible oversight, not the paper tigers that we've seen in a couple of other spaces. The other part that I think is really important is thinking about data, right? So as a researcher, advocates like myself and plenty of others have talked about, we simply don't know, right? So DOC and litigation, the Department of Corrections and Litigation, may file a piece of paper that says, we are adhering to the CDC guidelines. And yet they don't refer to, well, which guidelines? Based on what expertise? With who, right? And so I think, you know, part of what correctional officials and oversight officials, where they kind of exist, can be doing concretely is to make these walls so much more transparent than they are now, right? It took a lot of work simply to get a listing of, are they testing? How many test kits were delivered? How, you know, what are the populations? This should be regular public information, and we should be set up to be transparent in that way. The last point that I would make on this is we do have some independent oversight officials who are associated with jails. And I really think that their role is not just to advise correctional officials on what they should be doing, but they occupy a unique place where they can put their foot in the door, right? And where they can hold the door open for families, for communities to engage and to connect. Actually, oversight officials have enormous convening power, and I would love to see them use that convening power in a way that uplifts all of the interests that are present in jails and prisons. And so I think that there's some real opportunities there for where we have oversight officials to ensure greater transparency, to push for the collection and distribution of data, but most importantly, to hold the door open for the engagement of families and communities.
Thank you. Thank you for that. So our next round of questions is really kind of forward-looking here. Certainly this is a crisis. Certainly we are going to be able to get more folks released, and certainly there are folks who we will not be able to get released, and we're trying to push as hard as we can to make that happen. And this is not happening in a vacuum. There's infrastructure that's required, as was named. There's resources that's required, as was named. And all of us on this call have long-term visions that we are pushing for. And so the question for our panelists, and we'll start with you, Andrea, and work our way over, what do we need to do in this moment to build towards the long-term visions, right? For example, if we know that jail reductions or reforms that we're winning now are in place, how do we make sure those things aren't reversed once a quarantine is lifted or a state of emergency is lifted? So what are the things that you see are necessary where you're fighting, or broadly that we need to do now to move towards those long-term visions?
So, I mean, I think it's important that, you know, for every step that we take right now, that we can place it in a long-term path. And I think that our actions today need to have that mobilizing effect. You know, building on what Patrice and Doug were talking about in terms of reimagining what public safety means, that means public health, right? If we are not healthy, we are not safe. And so, you know, I think part of the narrative change, part of the mental change that Ronald was pushing us to really engage with, is to say that public health is central to public safety. And any public safety strategy which does not account for the health of our communities or for the vibrancy of our community, right? If we are all sick, we can't lean in the ways that we were designed to do. And so I think that's the first move, is embedding that as a central part of everything that we talk about, and it grounds every move that we make. I think more concretely, what we also have an opportunity to do is to really shut down cells, right? And so as we move people out, we need to think specifically about, well, what happens to that space after that person leaves, right? And that right now, when we talk about conditions, we can talk about, okay, you have released a significant amount of your population, maybe not as many as we think you should have, but a significant amount. So now you can proceed to the next phase, which is being able to ensure social distancing within these facilities and a stop to your standard operational practices that make people inside less safe. Cell searches, pat downs, etc. right? Then we have these empty cells. Well, what do we do with them, right? We convert them, right? Converting them into spaces that actually support the health of the people who are incarcerated. So we could think about, you know, video consoles for being able to pursue GEDs, being able to pursue learning, right? Putting correctional dollars into the investment for the electrical resources that are going to be needed to convert that cell into a different purpose, right? Pushing for the expenditure of resources to convert cells such that they can't be easily converted back to beds, right? And thinking about maybe, you know, for example, in the New Orleans jail, we have no in-person visitation. Long before this pandemic started, it was built without in-person visitation, right? That is absolutely wrong. And I am hopeful that we will return to a point where people can see their children and their parents and their brothers and their sisters and see their face directly. And that means maybe we take an entire wing of cells and we convert that, right? Bang out some walls and convert it into visitation, right? It's also an opportunity to transform the spaces themselves, right? So prisons and jails do not need to have punitive architecture, right? They can let in daylight and still be places where we think about how do we support the health of these people who are inside so that when they come back to us, they come back healthy, which supports our entire public safety of our community. And so I would really focus on those couple of things, right? So first, grounding, extending, and embedding this idea that public health is public safety. And then second, being creative. As we clear a cell, we transform a cell. And think concretely about what are the ways that we can most radically transform those cells such that they can't be used to cage human beings again.
Thank you for that. Ronald, same question to you. What are the things we need to do right now to move us towards the long-term vision?
Yeah, I think that's a $64,000 question. And I say to what Andrea said a minute ago, my goodness, I don't want to cast aspersions, but to think that you can't have face-to-face or in-person visits just seems like something from, antiquity, honestly. So one of the things that I think this particular moment gives us an opportunity to do, and it's what has already been mentioned, and that's reimagining our systems. So we already know we're the largest jailer in the world, right? And we know that there has been a consensus recently with people on the left and the right to reform our systems. There have been some serious challenges about passing laws in this country, but several laws that have been passed relate specifically to criminal justice reform on the federal level as well as in the states and cities. So to think that this could have happened previously is like unheard of. So one thing that this moment allows us to do is to think about something that other countries have been doing for a long time, and that's this idea of amnesty. So other countries, after a period of time, there's a look back. So you look back and determine, do we need to have our prison system? We look back at individuals. This person was incarcerated for X number of time. What has this person done during his or her incarceration? Has the person been involved in programs? Has the person got self-educated? Has the person received additional services? So we should use this opportunity to say, this person was sentenced to X, we can let this person go now, because we are seriously a country that is thinking about public safety, not as using our systems for purely punitive purposes, which they were, now that's what they've been designed to do. So I'll say this is a real opportunity. Michael Tarnry wrote a book called Moral Panics. What that book speaks about is how in each state, when there was a particularly heinous crime that was committed, those particular states or local jurisdictions passed laws to increase the chances that people will be incarcerated, to increase the chances that fewer people will be released, et cetera, et cetera. This is a moral panic, but in a different way. There's a panic, but we should be thinking about the exact reverse. How is it that we can not just allow for people to be released, but how we can sustain that over time? Because when our incarceration numbers were going up, they were going up even as crime rates were going down. And that was happening by people who were on the left and people who were on the right. So if we don't think about this going forward, then we'll be right back, Mark Anthony, to where, like you said, we'll be right back in the position that we were in previously, where we let all these people out because of a pandemic, but now we're back to where we were previously. We have millions of dollars in our budget to incarcerate people, and we have all of these cells. We're not going to have cells and not use them. We're not going to do what Andrea is talking about, which is to retool and repurpose and recalibrate and use these cells for something that benefits people's health and well-being. No, we're going to put bodies in those cells. And in some instances, we'll put 2 people in the cell. So we need, this is, like I said, this is a chance for us to reconsider the way that we've been incarcerating people, the length of time that people have been inside, et cetera. So that is what, we have over 100 people on this meeting now. I say those are some of the things that we could think about going forward.
Thank you, Ronald. Thank you so much for that piece around amnesty. Really appreciate that frame as well. Patrice, same question for you. What are the things that we need to be doing now to move us towards the long-term vision?
Well, I'm pretty sure people saw me hooping and hollering, on mute, because I loved what Andrea had to say, loved what Ronald had to say. Like, we're just in such a important moment. We're in an opening. Much of the work that we've been doing for years has been accelerated, as Ronald said earlier. And we have to, and this is not just advocates, but this is appointed officials, this is elected officials. We collectively have to make sure that the work that we are doing now and the progress we've made in this COVID-19 moment is not reversed when, quote, the pandemic is over. Because before there was a COVID-19, there was mass incarceration as a pandemic in our country. And so my challenge to people who are on this, who happen to be appointed officials or elected officials, is see this as your opportunity to rearrange how you've been relating to your city, your state, your county, your parish. Like, this is that opportunity. We do not have to go back. We don't have to go back to arresting 600 people a day. That's what the sheriffs were doing. It's now down to under 50. We don't have to go back to having 1,000 people going in and out of the jails. That's what LA County looked like pre-COVID. We do not have to go back to that. We can not only keep going where we're at, but we can even go further. We can actually have bail reform that is humane. We can move us further in really treating the people who have severe mental illness with the treatment they need instead of locking them up in a jail cell. I mean, we are in this ripe moment, and while it is scary and there is so much havoc happening, our space, in the criminal justice space, we are seeing things happen that they told us wouldn't happen for decades. They told us it couldn't happen. We know it's not true anymore. And I feel deeply passionate about this because I am hearing, like many of us on this panel, we hear the mothers and the fathers and the sisters and the cousins and the siblings who have cried for help about their loved one facing 25 years to life, or being sick in jail and not getting the services they need. Now is the opportunity to reimagine that space. And I would also say, for us in LA County, we were told that we were never going to be able to stop the $3.5 billion jail plan that they had on our laps, and we did stop it. And so anything is possible when you organize. Anything is possible when you're in community, when you're advocating as a team. And right now, as much as it's a painful moment, I've also seen some of the most powerful acts of humanity. And so I'm excited about our possibilities, and I hope that we can stay in a place of possibility as we continue to move forward.
Thank you so much for that, Patrice. Douglas, same to you. What do we have to do right now to move towards the long-term vision?
Yeah, I mean, I think we do need to consider that how easy it was in a lot of counties to reduce their populations and to do it quickly, to recognize how much nonsense winds up in our county jail and for how long people wind up there. I think we have to recognize that it's oftentimes a product, or it's usually a product of police saturation, right? Because we use police to resolve just about everything in our society. I can almost guarantee in the Texas legislature that there will be legislation and funding requests to get new police squads just to deal with domestic violence, right? And they're going to elevate penalties for domestic violence because that's how our society always deals with matters matters like these. And it is time for us to reimagine. Prison only works because of the unimagined possibilities for making people safe, for respecting people's rights, for learning about accountability. And it is time for us to imagine that. The other thing that's really pressing on me is recognizing what truly represents the safety net of health, of education, of family well-being in our society, and understanding, at least in a state like Texas and probably in all of your states, just how under threat it will be as a result of the recession, if not depression, to come, right? In Texas, when we had a minor budget shortfall in comparison to what we're going to be dealing with right now, they cut $5 billion out of public schools. So everything that you think we take for granted, public health, Medicaid, optional services under Medicaid, children's health, all of that has a bullseye on it right now. And we have to recognize that those are fundamental to creating health, for creating well-being. and we need to support it. We have to recognize those things that don't make us safe, and that's police saturation. It's having 104 prisons locking up 140,000 people. That actually doesn't make us safe, and we need to invest in those things that actually make us safe.
Thank you for that, Douglas, and thank you to all the panelists. This is really motivating and insightful, just commentary on the work that needs to be done, but also the work that you all are actually doing. And so it's really inspiring to be a part of this conversation. And so we're moving to question and answers, and we have several questions that have been keyed up, and we'll offer opportunity for folks to jump in connected to this. And since we just had that last response from you, Douglas, around budgets, I want to lift up this question. Comes from Michelle, which is asking us, what is the, as we're looking at this moment and current budgets are changing and they are shifting, what can we do to push civilian oversight to prepare for that? And what role can oversight play in shifting budgets in this moment? Douglas, you spoke to that clearly in the last comment. I want to hear from other folks if you have thoughts around what role can oversight mechanisms play in shifting budgets as we're moving into this really critical economic moment.
I can speak to that. I mean, I think this is the response to this question is a little bit, it's two-pronged. I mean, one, I think the people have to always challenge budgets that come out of the counties or states that they are in. So it's not just oversight bodies. When we fought for our oversight body, it was never because the oversight body was a replacement for the people and the replacement for us building our power and organizing our power. Oversight bodies can leverage what's already happening that's coming from the community. And so I just want to make sure that, for the person who asked this question, that an oversight body can push and challenge the people who appointed them or elected them to that body. A lot of our oversight bodies are not elected, they're appointed. And they're usually appointed by the elected officials who are in charge of those budgets. So they can have those kind of challenging conversations. I know here in Los Angeles, the sheriff is asking for they're always asking, law enforcement's always gonna ask for more money. That's just the MO. That's their job, to ask for more money. Our job as community members and community advocates are to advocate for where we think dollars should go. And so if a sheriff or a law enforcement department every single year gets more money, but housing either receives none or gets cut, then we know that the priority should be calling for our elected officials or important officials, calling them out on why do we keep securing budgets for law enforcement, but we either decrease or do not secure budgets for housing, for healthcare, for public schooling. And so this is an organizing conversation, and oversight bodies, I would hope, would also have that challenging conversation to say, hey, we should not just be relying on law enforcement to be the sort of social blanket for social ills. That's not their role. We need to be securing dollars, and we need to be in this moment, not after the fact. We have to be fighting for those dollars right now for public housing, for public education, for jobs. Those dollars, and it's important because what we hear in Los Angeles, and I'm pretty sure you hear this across the country, is, okay, we're gonna release all these people from jail. Well, where are they gonna go? Because we don't have enough community beds for them. We haven't created the community care infrastructure that we so much believe in. Okay, that's true. So then right now, let's earmark those dollars. Let's earmark dollars to improve the community care that needs to happen outside of jails and outside of prisons. And I think that is the call to action. That's been our call to action pre-COVID-19. It's our call to action right now during COVID-19. It's going to be our call to action post-COVID-19.
I mean, to build on some of the beautiful and inspirational work that Patrice has just mentioned, we can think about correctional oversight officials as embedded change agents, right? That they have a nimbleness and a flexibility where they can step back and look at something systematically, right? They can look at it structurally and say, wait a minute. So what I'm hearing from community is that they need assistance in public housing for when their people come home, right? That we need to have affordable housing throughout our city. So through the power of convening, right? Being able to say, okay, well, let's get some ed folks, some health folks, some housing folks from other agencies in the same room and talk about how can we collect and pool resources towards supporting people who are coming home, right? And people who we think are best and at their healthiest self when they are in community, right? And how do we marshal resources for that? And so that nimbleness, that ability to seek funds outside of the traditional law enforcement budgets and to be able to pool them to support people, who face enormous challenges in coming back home. And so this may be one way that they can help reduce those challenges.
Awesome. So I'm going to lift up some other questions, and folks should continue to weigh in on any of the questions that are being lifted up so far. But just a practical question that's coming from Christian. Our staff used to tour the New York City jails daily, but due to COVID, we now work from home. Is it possible to complete effective jail oversight outside the jails? And if so, how do you manage that? What are some thoughts that folks have around that?
I don't think you can conduct oversight without an ability to go, inside of facilities. How are you doing oversight? There's no virtual oversight. You have to be able to go into the facilities. You have to be able to communicate with the population, not just the incarcerated population, but with the staff and, everybody that has to interact with the folks that work there. I don't think it's realistic. I just think that people need to make sure that they have the precautions in place. So people need to have masks, right? And gloves and whatever else that they're using so that people can be safe and make sure that, folks who are infected or quarantined, et cetera. Because otherwise, I mean, we might be having all these virtual meetings, but if part of your job is to provide oversight for facilities, then you need to be able to go into the facilities. I don't think it's practical to be able to do it virtually.
Yeah, I mean, I will just piggyback on this. I think it's really important for oversight bodies to figure out a way to keep going inside. We have the same issue here where folks are, being told that they can't go inside, and I think that should be challenged. And for us, we're challenging with a lawsuit so that we can get people inside. Many of the folks inside, be it folks incarcerated or staff, they really do depend on the oversight bodies who get to go inside to keep accountability open. And it's with anything. If there isn't someone holding you accountable to it, it could go sour quickly. And we think in this moment, for folks who are being told they can't go inside their jails, I think there should be some challenge and pushback to that. Maybe it's not as often. Maybe it's not daily, but it's weekly. But I think we need to maintain some sort of normalcy around oversight. There's oversight for a reason. That oversight body got created for a reason. And we don't want to have to go back to the reasons why those oversight bodies were created in the first place.
Briefly, I'd just add that, oversight officials, when they go into jails, y'all are frontline staff. We are reconceptualizing what it means to be on the front lines. Our grocery workers are frontline staff. Our transit drivers are frontline staff. And although we may not have imagined it this way before the pandemic, y'all are frontline staff. And that is service that we all benefit from. And so I think you carry the hopes and wishes of entire communities when you go in. And although it's not the same as a mask, I think that it does take courage. And I think that courage is rewarded the same way we see that courage from everyday citizens in every single city.
Definitely. Thank you so much for that, Andrea. So we have a few more questions here, and we have about 20 minutes. We have some time to really dig into them. And I also just want to acknowledge that Patrice had to leave. early, and so we just want to say thank you to her and for all of her work and for being a part of this conversation. Really just shout out and sending love that way. So there was actually two questions that are connected. One was generally, how have public health departments been engaged or are being engaged in this moment? And there was a question specifically for you, Andrea, if you could cite the public health authority that you had mentioned earlier that you had engaged with as folks are trying to push locally in Illinois to do something similar.
Yeah, I'm happy to. And so, so it comes out of state law. So Louisiana revised statute 40, section 5, provides unique authorities to the Department of Health to issue guidelines for a pandemic in general. And then there's a subsequent section which says specifically around prisons and jails to prescribe the required standards and guidelines in a prison and jail, separate from the pandemic provision, right? And so there's actually two different ways. One is through the emergency nature of the pandemic, and the other is through a standing obligation, though often neglected, for public health agencies to be involved in the conditions that are inside of a prison and jail. And so, you know, that is Louisiana specific language, but there may be in the Illinois Code, for example, specific authority as well. It's not, you know, I've been researching and writing on prisons for a really long time, and it's the first time that I've really looked at that statute, to be quite honest, because I've always focused on the law enforcement, correctional portion of the code. So that's the first thing. The second thing in terms of how we have engaged, and I say we like the collective we, but this effort in particular was led by Voice of the Experienced, which is an incredible organization that you should really check out at some point, vote-nola.org. And what they did is they sent a letter basically citing these statutory authorities to the Louisiana Department of Health, Corrections, the governor, basically all the CCs, saying, so, you know, are you fulfilling your legal obligations, right? You have the authority to engage in this. And one of, it was amazing. The Louisiana Department of Health issued a letter that had a number of guidelines that should be implemented in all correctional facilities. And the last point of the last bullet point actually recommended depopulation to the extent that social distancing could not be enacted. And that was issued by the leading official. Unfortunately, that letter was rescinded 24 hours later by a non-medical professional who also happens to be the highest lawyer in the employ of the Louisiana Department of Health. We have since had a change in leadership, not due to pandemic, but due to pre-existing kind of departures and political appointees. And so the work starts anew, convincing them to reinstitute the guidance that was put into place. So that's at the state level. County officials are, in Louisiana through our code, essentially deputized or representatives of the statewide health director. And so they have unique parish or county level duties, which also include prisons and jails. And so, you know, bringing them into the correctional conversations has been a game changer. You know, that, and so that's some of the ways that we've engaged through letter writing campaigns, through trying to put people in the same conversation, as well as looking and exploring those bases for authorities for them to speak and really implement their expertise, right? If not now, then when?
Definitely, definitely. And I certainly share like the learning around some of the ways in which the codes have provided some leverage for us here locally in Los Angeles. I mean, this was the first time that I had understood there was a local health officer that was a appointed public health position by the Board of Supervisors, and a government code gave that local health officer the authority to make recommendations and explicitly said the sheriffs has the power to execute on those recommendations, right? And so I hadn't seen that before COVID-19, and we certainly use that to leverage for more releases here in Los Angeles. And so thank you for that. Other folks should continue to weigh in on what are the ways in which you're seeing any of those questions that we've named play out. There's a specific question around ICE, and we are seeing in California, this is coming from Sharon, sheriffs are handing people over to ICE, and even in places where there's sanctuary state law. How do we see oversight mechanisms playing a role in challenging that, or just in general, what type of work do folks feel like is really relevant to stopping those transfers?
Well, I will just speak briefly that we don't necessarily work on that directly. What we do is that we take responsibility for those things for which we advocate, and we do that in partnership with those who are fighting the crimmigration system. So we're very intentional about, particularly during this crisis, advocating for measures that reduce law enforcement intercept as quickly as possible, that keep people out of jail without having to plea for doing those things that don't have consequences for people's immigration status or don't bring people unnecessarily into contact with the police. So I think just sort of intentionally coordinating with advocates in the crimmigration space.
Thank you.
I'd say, Mark Anthony, to that question about ISIS, New York City has been much more so than some other cities trying to push back against ICE, having people get detained and then discharged to their custody. So, I mean, in New York State, we recently passed a law too, where it was a 1 day to protect New Yorkers is the name of it. So if you were facing, right, a certain amount of time for a felony conviction, you were facing 365 days, then you automatically would be, put in a position where you would go to an ICE facility, be detained, and not have a chance to have your case, argued. But so we, Fortune Society and other advocates, the Immigration Defense Project and others, recently got pushed for the state, for Governor Cuomo to sign this particular bill. So now, just by reducing that by 1 day, 364 days, now you're not facing like immediate deportation. So that was something that we pushed for, and that's something that we're very proud of. But we do have periodically a situation where a person gets released into an ICE facility. So just the other day, now that we're 95% of our staff are working remotely, I asked one of our staff to check into what happened with one of the women who was incarcerated in Rosie's in Rikers Island. And the woman, there was an immigration issue, and she had been acquitted of some charges. Some charges had been dismissed, but she had one charge that was still pending, and she had been inside for all this time, but she couldn't get out because she was facing deportation. And so when we checked just literally last week, we found out that she was discharged to ICE facility, but now she has an ankle monitor and she's been released to the community. So we were very happy to hear through reaching out to her attorney, and we're now working to provide her with services in the community. So we know that it is happening, but we're working to decrease significantly that someone that we are serving inside of the facility goes from Rikers to one of the ICE facilities.
Thank you. So our next question here is, because of the delay and because of some of the limited releases that have happened, we're seeing more community transmission in some of the facilities, right? Certainly in Los Angeles, we've seen this where if someone is symptomatic in a large dorm, that one person may be moved to isolation, but then the whole dorm is put on quarantine, which means community spread is just made acceptable, right? And one of the things that we're hearing is the argument that folks can't be released because they then present more danger and more increased risk for transmitting COVID-19 outside of the jails. Our question from Christian is, do you have thoughts on how to address or counter that argument, both to administrators, legislators, and to the wider community?
Definitely. I definitely have ideas on that. So remember when most of us got our stay-at-home orders, right? The point for us staying home was that we wouldn't overwhelm our medical infrastructure, right? That our medical staff would not be faced with these horrible choices that we saw in Italy and in Spain to choose who lives or who dies, where we wouldn't have enough beds for people. And I think the same thing is true when we think about prisons and jails, right? So it's not an idea of, oh, well, let's just let them stay there and develop herd immunity inside of these facilities when we have rejected herd immunity for the to say, this is the same thing. Home, if you have symptoms, only come to the hospital if you need that life-saving treatment. And here, I think it's a very similar thing that we need to be talking about in prisons and jails, is the possibility of the very fragile and unstable systems in prisons and jails being completely overwhelmed. And that's not safe for anybody. People who are forced to live there versus also the people who are working there on an everyday basis.
Could I jump in, Mark Anthony? Ronald could probably speak to this in county jails system. There's no way you can social distance inside of a holding tank. This is so the argument is risk of death among people incarcerated in order to save people in the general population. That's literally what you are saying. Moreover, people, when they finish their sentence, there's no constitutional right to hold someone inside of a county jail or a prison, so releases continue to happen. So you basically created a petri dish where you're growing the virus, and then you're sending people that in our county jail systems, particularly in a place like Austin, where it's gentrifying and the rate of homelessness is increasing 15% every year, that you're releasing people literally to the streets, oftentimes infected.
I'll just say quickly too, a lot of people who are incarcerated in New York City jails were there mostly because they could not afford bail, right? So we have bail reform here. So it wasn't even about an issue of public safety. It was an issue that I can't afford $500, I can't afford $1,000, so I'm languishing in a jail cell because I can't pay to get out. So that's really, that argument is really like a red herring, because it's very expensive too to keep someone incarcerated in Rikers. I mean, it's over $200,000 a year with the $1 billion. But now I don't think it's like that anywhere else in the country. But the ratio of incarcerated people to correction officers, you have more correction officers than you have incarcerated people now, and that has only been exacerbated with COVID-19, reducing the numbers very significantly. One of the things that happened here is that the people, what they did was a hotel, and they were quarantined for that period of time. And then when the quarantine ended, then those individuals are able to come to Fortune because our Harlem office is still open for people who are being discharged. And so as long as you have some infrastructure in place to provide services for people, or to the point that was already made, allow people to go home. And if they have a room or something like that, then they could, self-quarantine there for the 14 days, because that's far better than just leaving them to languish inside the facility where the chances of infection are far greater. In particular, for those who have these pre-existing conditions. I mean, that is something that if you know the person has a certain condition, the chances of them getting and then dying is going to be much higher.
Yes to all of that. Everything that y'all said. Yes to all of it. So I think we have one more question around how should oversight be working with corrections unions to promote different and safer jail operations or jail population reductions? What are some thoughts that folks?
I'll start. I'll just say this, that there needs to be a reality check between the correction unions and the oversight groups, because more often than not, the unions are proposing positions that are contrary to what everyone else is calling for. So, and it's almost as if organizations like Fortune and some of the organizations that the other panelists work for, like, we are not as concerned about public safety as they are. When I live in the Northeast Bronx, so if someone is being discharged from Rikers, there's a likelihood that they're coming to live in my community, not necessarily in the community of the folks who are on the oversight committees. So what I'm saying is that there needs to be some real consensus between those groups, between the union folks and the oversight people, that this is what we want to see happen in our communities. Because inside the facilities, there's this, this idea of care, custody, and control, but there's also this idea of what happens for those who get discharged from the facilities, and what are some of the practical ways and reasons that we should be saying that people should be discharged. I think that there's no real continuity between what some oversight folks are saying and what some of the union people are saying. And I think some of the union people really need to have a reality check. I just need to be honest about that.
Thank you for that, Ronald. Go ahead, Andrea.
We don't have unions. We're a right to work state here in Louisiana. But I do think it's an opportunity to really push home how much the interests of staff who work inside and people who are forced to live inside, how aligned those interests are. They are breathing the same air, and that air does not care whether you have a conviction, whether there's pending criminal charges, or whether you're there to get your check. And so thinking about what makes all of us safer, I think is a critical perspective and an opportunity, right? So more outdoor time makes us all safer, right? When we have people who are separated, deprived of most of the normal mechanisms of control that we exercise in our everyday life, tempers are going to flare, people are going to push back, and what makes all of us safer is increasing programming, increasing opportunities to be healthy in mind and body and soul. And so using that perspective, that the air doesn't care why you were in the building. It's just the fact that you were in the building. And so you push that perspective, although, I will say, we don't have unions. And so this is all just in theory for me.
So thank you, y'all. I mean, this has been a really, really rich, motivating conversation. And I know all of you are doing really brilliant work, rigorous work, tiring work every day around this. And I just thank you, Douglas, thank you, Ronald, thank you, Andrea, thank you, Patrice, for taking the time in the midst of really high-paced campaigns and stressful work to have this conversation.
I believe that you just turned it back over to me. I'm sorry, my audio was lost. Okay, can you hear me now?
We got you.
Thank you. I just wanted to thank all of you again for being here today. I think I speak for our entire audience when I say how grateful I am for the knowledge and inspiration that all of you have passed along today. So thank you for your time and your words. I also want to take a moment to thank Kathleen Beltz, who was not on the panel but was instrumental in bringing all of you together and helping to plan this panel today, and Mark Anthony, of course, all of your work to moderate and pull all of this together has been phenomenal. So I'm very grateful to both you and Kathleen for your work behind the scenes to make what we saw today happen. So again, thank you, and thank you to all of our attendees, and we look forward to seeing you all back here virtually again in the near future. Thank you, and until we see you, be well and be safe.
Thank you.